Which of the following sums up raku pottery the best? A. A low-fire clay, usually white and impermeable. B. A medium-fire clay, often reddish-brown in color. C. A low-fire clay, usually hand-shaped and porous. D. A high-fire clay, often thrown on the wheel. Conscious learning can only serve as a monitor or an editor. A. Effective filter hypothesis. B. Cummins. C. Natural order hypothesis. D. Monitor hypothesis. Word recognition is A. Especially important to English language learners and students with reading disabilities. B. One of the building blocks of learning. C. Useful only to fluent readers. D. Culturally based. Is our intrinsic capacity to convey meaning through abstract symbols. The medium can be spoken word, written word, or signs. A. Semantics. B. Language. C. Syntax. D. Culture. Words with similar etymological origins. A. Cognates. B. Pragmatics. C. Idioms. D. Syntax. The instructional arrangement is for providing special education and related services to students from more than one school district. A. Multi-district class. B. Non-public day school. C. Advocacy. D. Cataracts. C. Sculptures were created with a less natural pose. D. Sculptures showed a more religious purpose. Negative transfer, using pronunciation, rules, idioms, or words with different meanings or implications. A. Common difficulties in a fifth language. B. Common difficulties in a second language. C. Common difficulties in a first language. D. Common difficulties in a third language. Native language in core academic phase and slowly integrate English. A. ESL interrelatedness. B. Dual language. C. Transitional bilingual. The method that words are placed together to create clauses, sentences, or phrases. A. Phonology. B. Morphology. C. Semantics. D. Syntax. Students are placed on the job for at least 2 hours per day in an instructional setup, but if they are prepared for the position, they can work there full-time. A. Vocational adjustment class. B. Multi-district class. C. Individual transition plan. D. Non-public day school. Which artistic movement unites the works of Man Ray, Marcel Duchamp, and Max Ernst? A. De Stijl. B. Bauhaus. C. Constructivism. D. Dada. The TExES was developed to address areas important to the development of Spanish reading and comprehension. A. TExES. B. Support role. C. Telpa. D. Domain 3. Which of the following represents a culturally sensitive special education classroom the best? A. Pairing students with similar backgrounds. B. Incorporating texts from various cultures. C. Showing popular films from different cultures. D. Acknowledging ethnic holidays and celebrations. Is a sustained period of speech or writing that expresses ideas longer than a sentence. For instance, writing conventions or social conventions. A. Discourse. B. Semantics. C. Culture. D. Pragmatics. Which of these is required as part of an enrichment curriculum for K-12 students under the Texas Education Code's essential knowledge and skills? A. Social studies. B. Mathematics. C. The sciences. D. Physical education. Motivational phrases used to describe a state in which a person believes that no matter how hard they try, they will fail. A. Bipolar disorder. B. Learned helplessness. C. Problem-focused coping. D. Talent learning. If ESL students have mastered scientific principles in their home languages, they can transfer these to English so that they can converse about science concepts. A. Discourse. B. Syntactic. C. Pragmatic. D. Semantic. CALP, Cognitive Academic Language Proficiency. A. Chomsky. B. Finocchiaro. C. Krashen. D. Cummins. The growth of this awareness is the capacity to recognize certain phonemes or sounds in a language. A. Phonological. B. Phonology. C. Idioms. D. Phonemic. Finding ways to keep core beliefs and traditions from the old culture while assimilating into and becoming a part of the new culture. A. Variation. B. Evolution. C. Adaptation. D. Assimilation. ESL students learn how to communicate effectively in English in order to get what they want and need in social settings. What branch of language is this usage under? A. Lexicon. B. Semantics. C. Pragmatics. D. Discourse. Technology used to help people with physical, cognitive, and speech impairments access places like school or home. A. Remediation. B. Cooperative learning. C. Affective disorder. D. Assistive technology. Which of the following was a principle of Bauhaus architecture and design? A. Structure should appear married to the ground. B. Visual weightlessness. C. Agility and flexibility. D. Form follows function. When under extreme stress, fear, or embarrassment, does the ELL learner put up a mental barrier? A. Intermediate fluency. B. Monitor hypothesis. C. Comprehensible input. D. Effective filter. A fifth grader with diabetes administers insulin to treat her condition. Which of the subsequent signs should alert a teacher that a pupil might be going through insulin shock? A. Muscle and joint pain. B. Trembling and irritability. C. An increased level of thirst. D. A high fever. The suggestion or implication of a meaning other than the explicit meaning of a word or phrase. A. Denotation. B. Connotation. C. Dialect. D. Alliteration. Which type of classroom instruction is required for ELL students in accordance with the TExES Administrative Code's English Language Proficiency Standards? A. ESL instruction integrated with content area instruction. B. ESL instruction preceding content area subject teaching. C. ESL instruction following teaching content area subjects. D. ESL instruction separately from content area instruction. A method of behavior modification that entails outlining the cost of a particular transgression before it happens, enforcing the punishment each time it does, and combining this with a reward to reinforce or teach the desired behavior. A. Refractive errors. B. Response cost. C. Response to intervention. D. Resource room. Which of the following actions exhibited by a 2-year-old child is the most obvious sign that the child's motor development may be compromised? A. Making involuntary hand movements. B. Difficulty coordinating hands and eyes. C. Inability to climb stairs with alternating feet. D. Frequently falling while running. Listening, speaking, reading, and writing is learned concurrently. A. ESL teaching methods. B. ESL interrelatedness. C. Cognitive processes. D. Developmental bilingual. "12,000 words, difficult statements, and at least 1 year." A. Effective filter. B. Advanced proficiency. C. Early production. D. Intermediate fluency. Ideas about a certain group that are oversimplified or overgeneralized based on hearsay or scant personal experience. A. Stereotyping. B. Connotation. C. Prejudice. D. Ethnocentrism. "6 months, 1,000 words, 1 and 2 word phrases." A. Intermediate fluency. B. Advanced proficiency. C. Early production. D. Speech emergent. Formerly known as grand mal seizures. characterized by a loss of consciousness. Characterized by a loss of consciousness, usually loses bladder control and becomes very drowsy when the seizure ends. A. Williams syndrome. B. Tonic or clonic seizures. C. Herpes simplex. Which of the following best sums up a feature shared by Egyptian and Mayan pyramids? A. A square base with 4 sides. B. A temple at the top. C. A tiered structure. D. An exterior of white limestone. Cooperative learning, learning experience assessment, content-based learning, language scaffolding, TPR total physical response. A. ESL teaching methods. B. Cooperative learning. C. Scaffolding learning. D. ESL interrelatedness. Is a group defined by its common views, values, and rules, which are controlled by patterns of behavior. 2001's Paraguay and Boyle. It includes what individuals know, think, and do, as well as what they produce and use. A. Religion. B. Prejudice. C. Language. D. Culture. After moving to America, it takes around for ESLs to attain the language acquisition skills indicated by BICS. A. No determined duration. B. 6 months to 2 years. C. Individually unique times. D. From 5 to 7 years. Causes of strabismus include glaucoma, retinal detachment, amblyopia, and myopia. A. Glaucoma. B. Retinopathy of prematurity. C. Optic nerve hypoplasia. D. Respiratory distress syndrome. Which of the following approaches does not work to improve the composition of a photograph? A. Frame within a frame. B. The rule of odds. C. The rule of thirds. D. Boxing it in. Is an effective teaching technique whereby small groups of students, each with varying degrees of aptitude, employ a range of learning exercises to increase their grasp of a subject. A. Scaffolding learning. B. Speech emergent. C. Cooperative learning. D. Support role. Errors of this kind include misplaced modifiers, dangling participles, and a lack of subject-verb agreement in a student's writing. A. Semantics. B. Syntax. C. Phonology. D. Morphology. When a test question involves a culturally different learner of learners, always consider a choice that magnifies the dignity and importance of the learner's culture. A. Prejudice. B. Culture. C. Language. D. Religion. A new class of ESL students is shown how to add the edending to normal verbs to signify past tense. This is primarily relevant to A. Phonology. B. Semantics. C. Syntax. D. Morphology. Throughout the last stages of fetal development, a child may contract a venereal illness that causes MR. A. Herpes simplex Ritalin. B. Ritalin. C. Anoxia. D. Syphilis. Which of the following is a substance that Renaissance painters typically use to seal a canvas? A. Rabbit skin glue. B. Linseed oil. C. Acrylic. D. Tempera. Total physical response. Say a single action word then perform that action. A. TPR. B. Bix. C. LPAC. D. SIOP. Which of the following medical conditions falls under the category of other health impairment disability? A. Traumatic brain injury. B. Perceptual disability. C. Asthma. D. Cerebral palsy.